I think when a lot of people think about telehealth, they think like, oh, I'm just going to be on the phone all day, or I'm not really going to be caring for patients. And the patients that are in our loops, we really get to know because they're in it for an extended period of time, much like you'd be caring for somebody in a clinic or at a hospital stay. And so being able to make connections with their patients and care for them in a new way has been so important to them. I recently had a nurse, she was just talking to me about how she really feels like this fills the gaps that she would see in the clinic or in the hospital by having this opportunity for our clinical staff to interact with the patients and for the patients to receive the education and care that they need outside of our hospitals and clinics across our ministry.
We're able to see all of our interactions with the patients. If we need something from a provider who doesn't have access to the loops, our providers are able to look and see, and it pulls it in as a PDF, and they're able to see our conversations back and forth. We're able to copy in the pictures that the patients send and put it in our notes, and you're able to see just kind of the real time what's going on, what education they're getting, but also it doesn't clutter up Epic. So you're able to see it loops it into one PDF, and then the important notes we document on the side. So it's kind of just an additional, in case someone wants to look, see some background information on what's been being said. And that's been very valuable. And we also, I think just the platform itself, being able to work solely out of that and not have to flip back and forth between different platforms and see the education the patients are getting.
We were tasked with bringing healthcare to patients in a new and different way, particularly patients that live in more distressed communities and often have difficulty finding healthcare in the traditional sense. And specifically for my program, it was pregnant and postpartum women. So we really liked the idea of the loop because it was something that they could use on their phone and have with them. And it provided that great educational content and a way to reach a registered nurse 24/7, 365, which is one of our guiding principles at OSF On Call. So it was really a great fit for us.
I can say on the floor as a bedside nurse, I never got the communication with patients that they deserve. It was always when my next med was due, when I was going to give the next infusion. It was never actually talking to the patient. And I think that's the biggest change is I can provide education to the patients and I can talk with them in different ways that I wouldn't normally get to. And I do feel like that has saved time. So the biggest thing is when a patient checks in, I can either call them right away if I want to, if it's significant enough that they needed a call or wanted a call. So I can call and get their needs met immediately. That's within 2 minutes, a minute of getting their chat. And then I can also chat back and forth with them. We do have patients that, they're the younger population, the younger pregnant population, so they choose to just message us. I'll call them, but they'll ignore me. But they do message me right back. So that has definitely been time saving.
If you have to do a one-on-one phone call with each of these patients, that's a lot of time. And we would definitely not be able to touch as many women as we can on a day-to-day basis if we didn't have that chat feature through the loop. And additionally, our patients like that chat feature. They're just in that demographic where that is what works the best for them. They can quickly just message us a question, and we can really get back to them right away. And they can go on with their day. I think especially in pregnancy, there's so many things that change. There's so many unknowns. A lot of women have a lot of trouble with depression and feel anxious. And sometimes they just want to know what they're doing is the right thing and just get that reassurance. And you can accomplish that so nicely through that chat feature and just reassure those moms. Where a phone call would take so much more time. They would have to wait to get to a nurse. It's just been wonderful for our team.